Hi, my name is Libby Ward and I will be placing a female Foley catheter. So the first thing I'm going to do is perform hand hygiene and look at my MAR for my patient. So I have a MAR here for Miss Ren Harumi. She's a female, date of birth 3/3/83. She's been admitted for acute kidney failure syndrome. She is scheduled for multiple diagnostic tests tomorrow and needs strict intake and output. Anticipating this, the physician orders an anchor retention catheter to a dependent drainage system staff. So now that I've looked at my MR, I also confirmed this order with the healthcare provider, and I'm going to now gather all my supplies I need for this procedure. So I have a wash basin with towels and washcloths and soap for perineal care. I have sterile gloves. They're my size. They're unopened, intact. They don't expire till 2022, so they're not expired, so therefore they're sterile because of all those characteristics, and they're safe to use for sterile procedures. I want to make sure I have the right catheter for this procedure. I have a hydrogel coated latex Foley tray, which is Foley catheter and retention catheter are the same, so I have the right catheter. 14 French is the size for this catheter. It's the appropriate size for a female patient. It's unopened, it's intact, and it does not expire until 2021, so therefore it's sterile and can be used for this procedure as well. So now I have all my supplies. I'm going to enter my patient's room. Hi, Miss Harumi. My name's Libby. I'm going to be your nurse today. I'm going to close this door and provide for privacy. So today we are going to be placing a Foley catheter. You have a lot of diagnostic tests tomorrow, so you need strict intake and output measurements. So we will be placing a Foley catheter for that purpose. Is that okay? Yes. And so now I'm going to perform hand hygiene before I begin anything with my patient. Okay, can you tell me your name and your date of birth? She indicates her name is Ren Harumi. Her armband says Ren Harumi, and my MAR says Ren Harumi. She indicates her date of birth is 03/3/83. Her armband says 3/3/83, and her MAR says 3/3/83. Her ID number on the armband is 160-01-1180. And on her MAR, that matches 160-01-1180. So now that I've confirmed the patient, I'm going to establish LOC. Can you tell me your name one more time, ma'am? She says Ren Harumi. Do you know where you are today? She says UK Hospital. Do you know what month it is? She says it's March. And do you know the current president of the United States? And she says Donald Trump. So she is oriented ×3 to person, place, and time. Ma'am, do you have any allergies to latex or betadine? She says no, she does not have an allergy to either latex or betadine, so the materials I brought can be used. Okay, well, before I begin, I'm going to raise both bed rails, raise the bed to an appropriate height for good body mechanics, and lower the bed rail closest to me. I'm going to perform hand hygiene. Miss Harumi, I'm going to take a look at your bladder. I'm going to palpate, which means just press and kind of feel on your bladder, and percuss. Is that okay? She says yes. I'm going to put some clean gloves on. So I'm just going to move your gown. Does this do you have any pain or tenderness while I palpate? She says no, but the bladder does feel distended, which would be consistent with urine in the bladder. When I percuss, there's a dull percussion sound, which is also consistent with a urine in the bladder. And to confirm urine retention, I would get a bladder scanner and scan the bladder. So I'm gonna return that. Remove my gloves and perform hand hygiene. Now, Miss Harumi, I'm going to perform perineal care. This will help ensure sterility for your catheterization and to reduce the risk of infection, okay? She says, okay, so I'm gonna wash my hands one more time, put on a new set of clean gloves. Now, Miss Harumi, I'm gonna help you kind of move your hips and legs outwards to make it more comfortable for this procedure. Will that be okay? She says yes. So I get my basin filled with warm water, my washcloths, my towels. Okay, so now I'm going to help you kind of move your legs into a frog position. by moving your hip outward and your knee bent towards your waist. Both sides, okay? So now I'm gonna start by dipping this washcloth in warm water, putting soap and cleaning the area furthest from me. Moving the washcloth to a new area, warm water, soap, area closest to me, new part of the washcloth, water, water, soap, and then down the middle, discard. Now I'm just going to rinse so these won't have any soap on it. So I'm gonna wash the area furthest from me. Closest. Down the middle. Okay. Now I'm going to take this towel and pat dry. Okay. Now that I'm done with that, I'm going to clean up my supplies, remove my gloves, and perform hand hygiene. Now I'm going to get set up for your catheterization procedure. So I have my sterile kit and my sterile gloves. My gloves over there, my kit right here. So I'm taking my kit out of the box, kind of just dropping that there. It's like a trash area, and I'll clean that up after. And I'm gonna tuck this ID badge down so it doesn't get in the way of my sterile field. Okay, so now I'm going to open this, so starting away from me. Now that I have the sterile field open, I'm going to want to apply my sterile gloves, but I don't want to risk contaminating this field right here. So not turning my back towards my patient or the sterile field. I'm going to slide over here so I can see both the sterile field and my patient while applying my sterile gloves. So I'm going to open my gloves, discard of the package. I had my sterile gloves applied to remove that and walk back over to my sterile field. Okay, so I'm going to lay out this drape with the shiny side down and drape it and release. Okay, now I'm going to unpack the contents. So there's a couple things that I don't need. So I'm just going to instantly discard. Okay. So now I'm going to get set up. So I have my cotton balls. I'm going to apply betadine over all of them. And then get my lubricant out. Apply it to the tray. Okay, so once that's applied, okay, now I'm going to lubricate the catheter. Once it's lubricated, I'm going to set it here. I'm also going to apply the sterile water syringe. Okay, so now I'm completely set up before I contaminate this hand. So now I'm going to place this on the patient, retract the labia, and clean with my betadine cotton balls. Yeah, so dispose of that. Okay, keeping the labia retracted, I'm going to get ready to insert the catheter. Okay, Mr. Rumi, I'm going to insert this catheter, and make sure you take nice deep breaths while I do this, okay? So I'm gonna insert on 3, making sure not to touch the catheter to any of the tissue or my hand to the labia. 1, 2, 3, take a nice deep breath. I'm going to keep inserting until I have urine, which I do now, and I'm going to put in 2 inches further. And with my non-dominant hand, I'm going to pinch, and I'm going to inflate the balloon with sterile water. And with 1 sweep, I'm going to remove with the balloon. 1, 2, 3. Okay, now I'm going to move this, dispose, and clean up all supplies. Remove my gloves. Perform hand hygiene. Okay, now I'm going to put on some new clean gloves, and I would perform perineal care for this patient just as I did in the beginning, to remove any irritants such as betadine or lubricant. Also cleaning the catheter if it because it could have betadine or lubricant on as well. So catheter and perineal care. And then after that's over, I would take off my dirty gloves, wash my hands, and put on clean gloves. So now that I've done all of that, I'm going to secure the catheter to my patient. So I'm going to grab tape, 2 pieces. So I'm going to secure it to the leg, and then secure the catheter, and then I'm going to put the bag below the waist, so it's below the bladder, and put it on a non-movable part of the bed, so right here. And then I'm going to look at the bag for the color, the consistency, and the amount of urine that came out of her catheter. So once I have done all of that, I'm going to take off my gloves, perform hand hygiene. I'm going to raise both bed rails, lower the bed to the safest position, make sure my patient has a call light. Ask her, Ms. Rumi, do you need anything else from me? She says, no, not at this time. Okay, well, I'll be back in about an hour to check on you, okay? I'm going to make sure I clean up all of my supplies and go out to document. So now I'm going to document on my patient. Ren Harumi received a retention catheter on March 22nd, 2020 at 0900 due to multiple diagnostic tests and needs strict intake and output. A 14 French 4.7 millimeter 5 ml catheter pre-connected to a 2,000 milliliter drainage bag with Luer slip sampling was placed. The type of catheter was a hydro-coated latex Foley tray. Client tolerated procedure well, no issues on insertion. Urine was a pale yellow color, clear consistency, and 250 mLs of urine was drained. So then I would sign Libby Ward, UKSN, the date 03/22/2020 at 0900.